Hey everybody, it's Jill Kay, functional nutritionist and owner of Down to Earth Wellness. Today I'm meeting with my friend Monika. She is the owner of Create Health. She is a nurse practitioner who is certified in functional medicine through the Kresser Institute and is working towards certification through the Institute of Functional Medicine. So I wanted to meet with Monika to learn more about what she does, who she helps, who she works with, what her program looks like, what it looks like to work with her. So thanks for joining me today for our little mini interview, Monika.
Awesome. Thanks, Jill. Thanks for having me.
Let's dive in. So I have some questions for you I want to go through, and maybe my audience would love to know and learn more about you and what you do. What got you into the health and wellness field in the first place? I guess you got into first nurse practitioning. What got you into that? Did you have a health struggle, or were you passionate about health?
Yeah, to be honest, like when I finished high school, I just remember thinking, well, I don't really want to be a teacher, so why don't I be a nurse? So really I don't remember there being a lot more thought, to be honest, other than, I had an aunt who was a nurse who, I really looked up to. And also, growing up, I had a family who was, always open to, different models of health and different approaches to health. And so, I kind of grew up having sort of, an open mind regarding health. And like I said, with my aunt in nursing, I guess it just seemed like the right thing to do. And, as I, continued my career in nursing, I really noticed how many people just in the hospitals and in the clinics that I worked in who, really struggled with their health and were, in the hospital because of their chronic diseases, despite, following all the recommendations that they are given by their doctor. And, as time went on, I just really saw and learned that the conventional model is really well suited for acute care, trauma, infections, heart attacks, surgeries, all of these things. It's, where would we be today without modern medicine, right? But when it comes to these chronic diseases, conventional medicine doesn't seem to do a great job of sort of looking at what the root cause of these illnesses are, and how to treat them from its core, rather than just sort of giving medications to cover symptoms and that sort of thing. And so that really kind of growing up in a home where I had, people who were more open to alternative approaches to health, and then also seeing firsthandly, in the hospital, people not getting better despite following, doctors' recommendations. It really sort of, led me into this, this alternative medicine world. I had a great aunt who she lived until she was 98, and she really did not like the conventional model of care. She hated going to the doctor and hated hospitals. And, I remember her telling me how when she was 18 years old and as a young woman, how she experienced a lot of digestive struggles and that kind of thing. And ultimately it was a naturopath who helped her. And so she really lived her life following the recommendations of her naturopath. And she was somebody who was just, she really was a true queen. If you had ever, anybody who had met her and knew her was just really amazed by her grace and her class and her intelligence. And, like I said, having somebody in my life who followed these principles and was the person that she was, it just really inspired me to really kind of look into this world. So sorry, that was kind of a long answer to a short question. And that second part too, I've been fortunate to not experience a severe health struggle, unlike a lot of people coming into this world, right, of alternative medicine. Lots of people struggle with something and aren't getting answers in the conventional world, and end up, investigating it themselves, and then end up being practitioners. So
Mhm.
like I
So
said, I
true.
was I was more somebody that experienced things as an from sort of an outside
Yeah.
view
Well,
that way.
it
So
sounds really interesting. Yeah, like you had that positive influence in your life,
mhm.
a family member. And I was the same thing when I was younger. I was like, I don't know what I want to do, but I want to do something in the health field. And I didn't know what was out there. And
Yeah.
so I was looking at nursing at first, and then I was enrolled in it. And then I discovered like holistic nutrition. I never heard of that. I went for nutrition, different nutrition, then discovered holistic nutrition, then discovered functional nutrition. And it was just like a starting to evolve back then, right? When we were a decade
Yeah.
ago or longer.
Well,
Um,
yeah.
but back then, when there was no Google and stuff, like it was like, okay, the conventional career paths. And I'm in the same belief that like we need that conventional medicine and we need the natural approaches as well, holistic, functional, and they blend well together and
Totally.
synergy. Like we need both in an integrative approach. I was going to ask, could you tell us what a nurse practitioner does or how it's different than a doctor or a nurse, where it fits in the conventional medicine and the benefits of it?
Yeah, it's a good question because a lot of people don't actually know what a nurse practitioner is. But basically, a nurse practitioner is a registered nurse with a master's degree in nursing. So you must be an RN before you are eligible to become a nurse practitioner. And the difference between a RN and a nurse practitioner, other than the master's degree portion of it, is that this education gives you the authorization to prescribe treatments and medicines, order labs and diagnostics and interpret them, diagnose, refer on to specialists, that kind of thing.
Very
So
cool.
it is just sort of an expanded scope of practice.
Wow, that's really, really probably beneficial in small communities too, like the North and the Yukon and
Yeah,
stuff.
and that's actually, how the role really started. Like back in the 60s, they needed healthcare practitioners in, these remote communities, and
Oh,
a
really?
lot of doctors and, uh, and people within the healthcare field, didn't really want to work in those places. So they found, nurses and trained them up. And that's
Wow.
how the nurse practitioner evolved, was to kind of be in these sort of remote communities. And now it's sort of, it's evolving and changing, and you're finding that there's more and more NPs in urban areas. But yeah, that's sort of how
Okay.
it started. Yeah.
That's cool evolution. And it's, yeah, becoming more mainstream now everywhere.
Mhm.
That's really cool. And then I kind of got an idea of why you got interested in functional medicine, but it sounds like you became a nurse practitioner and then you were seeing that like we got to explore not root causes, but looking upstream, looking at the whole person, looking at healing on a deeper level. So that did that get you into functional medicine and what I guess got you into functional medicine and why do you like it?
Yeah, so actually what sort of was happening is, just even as an RN, like working in the hospital, I experienced just so many people struggling. And with my background with my upbringing of being exposed to alternative approaches and stuff, I just was thinking like there's got to be something different. Like this is not working. Like the system
Mm.
isn't working for a lot of people. People are still struggling, and I ended up, when I was kind of in this weird time in my life where I was like, what am I going to do? Like, how can I actually make a difference in people's lives? I know there's other answers, but I just couldn't kind of figure out exactly where I sort of was when it came to how could I help patients in the way I want to. And anyways, I was at this time in my life, I was doing some casual work in remote First Nations communities in Saskatchewan. And I ended up meeting a doctor that was working there. And he was, we started chatting, and he was telling me how he practiced functional medicine.
Wow.
And he, explained to me what it was and the principles. And right away, I was like, wow, this is exactly what I've been looking for. I just didn't know what it was called, or like how to kind of label it or figure it out. And so from there on, I just researched it and found a few different institutes and schools that offered it. And that's actually what really encouraged me to become a nurse practitioner, because I've finally found something that I was like, wow, this model of care makes sense to me, but how can I deliver this care to my patients in a meaningful way? And I really felt that I needed to be in a role which enabled me to diagnose, prescribe, order, that kind of thing. So that really propelled me into wanting to become a nurse practitioner, with the intention of down the road offering this kind of care. I really wanted to have a few years of experience of just sort of the primary care conventional medicine model of being a prescriber and that kind of thing. And so I had that, and then I slowly chipped towards my certification in functional medicine. So yeah, that's kind of how I really got into it, and what really encouraged me to become a nurse practitioner.
That's awesome. And like, yeah, they both blend together maybe quite nicely, the nurse practitioner and the functional medicine. So how do you find this helps your clients differently nowadays that you're blending these two together? And
Yeah, yeah, it's a good question, because one thing that I really love about being a nurse practitioner is, I'm a nurse,
Mhm.
and being a nurse, you really have it's been ingrained into you, sort of the art of nursing, the art of providing care and medicine. It's not just about the science, it's the art of it. So, that really, is about like, how are you connecting with your patient and in a therapeutic way? And, how are you providing care in a way that's holistic? So it's, in a way that's sort of addressing all aspects of the person. And I really love, that about nursing, that is sort of a big part of it. And within functional medicine, it's so similar in the sense that we are really looking at the whole person and looking at health in sort of a systems approach. So you understand that everything is connected, and every body system affects another. And like I said, it's just this holistic approach to care that the nurse practitioner is really geared towards providing care in that way. So I feel like it's a really great fit.
Right. Yeah. Looking at the whole person as a unique individual with unique
Mm,
needs and mind, body,
exactly.
spirit kind of approach.
Totally. Yes.
I like the functional and holistic approach for that as well. And like trying to
Mm,
look upstream and bringing the body into balance.
yeah.
Trying to figure out, why do you have headaches, or why is your skin flaring up, versus, just like, oh, take this, or this will help. But maybe we do need to take that and it will help, but let's also figure
Mm,
out what's out of balance or out of whack and support those body systems.
totally.
I
It's so
think
true.
that's the way to go. It's like a comprehensive approach.
Yes, absolutely.
So yeah, like I was gonna ask, I have quite a few questions. So we know how it blends together really nicely. They go together really well. Who do you find like you like to work with? Who benefits from working with you? Is it usually women you're working with hormonal issues or digestive issues or fatigue? Do you have a niche or a primary audience that kind of comes to see you?
Yeah. So as a nurse practitioner, I am trained to provide primary care. So that's really like chronic conditions. So I see a lot of people who have digestive issues, whether they have sort of a diagnosis of what's actually going on or not. So lots of digestive issues, and functional medicine is, because it's a way of providing care that really asks the why and the how. Really, like, why is this happening? How and why how did it manifest, and how can we address the root cause, right? So really, anybody who has a health condition that is just not getting answers for. So kind of back to the digestive disorders, anybody with a chronic disease, including, diabetes, depression, anything like that, hypertension. I do work with women who have, questions or concerns about their hormones, men as well. So really, yeah, any kind of chronic disease, I'm really geared towards treating.
Nice.
In functional medicine, uh, in asking those why and how questions, and also through advanced diagnostics. So labs like comprehensive like dysbiosis stool testing, and SIBO breath tests and salivary hormone testing, we can really get a closer look of what's really happening, and address those things. So those are some tools that I use as well, or those labs that you can't get through the conventional system.
Right. I was going to ask you, probably that's how it dances together. Both of those skill sets is you probably do some conventional lab testing. You have access to that, or prescribing where needed. And then you're over here on the functional side doing specific functional tests or functional blood works or workups and stuff like that, and putting them together.
Yeah, exactly. It's certainly not just, diet and supplements and that kind of thing. And that is such a huge
Mhm.
key portion of it. But definitely, I do order, labs from the hospital that are just like your routine labs, but I look at them with sort of a different, through the functional medicine approach, through sort of different ranges that I interpret things through. So generally, we have sort of a lower tolerance of what we think is normal, sort of thing, or abnormal. So just to kind of catch things before they really manifest. But yeah, and definitely not opposed to prescribing, conventional pharmaceuticals if that's something that's needed, because often, people do benefit from that. But it's also, incorporating those other things that, like the lifestyle and the diet, and sometimes the supplements that can be really beneficial, along with the advanced diagnostics too, is helpful.
Yeah. It's a really nice blend of skill sets.
Yeah.
I was going to ask then, what does it look like, or what does working with you look like? Is it like, how can people learn more? Is it like a 3-month program or a couple sessions? And you say you focus on food, diet, lifestyle, supplementation, and targeted lab tests. But yeah, if you want to take me through what that looks like, working with you.
Sure. Yeah. So what I have right now is I just have an Instagram page. I don't have a website yet, but on my Instagram page, I have my email listed there. So I ask people just if they're interested to send me an email, and then I'll send you an email back just to kind of describe exactly what I'm about, that sort of thing. And in that email is a link to my patient portal. And through that portal, I ask people to first book a 15-minute free discovery call. So that discovery call is basically just to sort of, meet you, just hear about what your goals are. And then that gives me an opportunity to chat about whether or not I think we're a good fit, and that kind of thing, or if I think somebody else might be able to address your concerns better. If we decide to proceed, then I'll get you to book in a 2-part initial consult. And the reason it's 2 parts is because it's a very sort of loaded appointment, or loaded appointment, I suppose. The first appointment is, it's about 2 to 3 hours long, and it consists of me taking a very thorough health history from in a timeline sort of fashion. So it starts with your family history, your mother's pregnancy with you, all the way to present day. And this really helps me sort of map out your life and figure out like how it is that you got to where you are today.
Mhm.
And time permitting, we do a physical exam. And then the second part of the consult, which can be about 1.5 to 2 hours ish, consists of, us going through any treatment plan that I think that we can start with, supplement that, and that includes supplements, maybe labs or diagnostics, and plus or minus physical exam. And we also go through lifestyle stuff then too. And then from there, we just book follow-ups.
Okay.
And you can either come to see me in person, or we can see each other through telehealth. I do like to have at least one in-person visit with the patient, just so I can, see you and we can meet and we can do the exam and that kind of thing. So, but I really want to try and make it as easy for people as possible. In this day and age, we are shorter and shorter on time, and I want to, make sure that we can connect if that's something you want to do. So.
Oh, that's great. And you work, you're still doing nurse practicing with like conventional medicine, and then part-time you're running Create Health, and you have an office downtown in Whitehorse, Yukon on Hawkins Street, right?
Yes, exactly. So yeah, I still work for the government as a nurse practitioner, and I work a lot, and I have a lot of experience with mental health disorders and addiction and that kind of thing. So that's something too that I'm again, when you're asking who I work with, I've got a lot of experience with mental health. And I mean, again, we're seeing that in this day and age, there's, lots of that going on, people struggling with their mental health. So, and that there's a lot of different, causes and that kind of thing that we can address through functional medicine as well. So, but yeah, I have my government job, and then I do this job once a week here, and then hoping to expand.
Yeah, for sure. Juggling both, but
Yeah.
I think it's great. So many, especially women clients I work with, would benefit from having access to a nurse practitioner and getting the lab work maybe they can't get, and get that thorough health assessment that they've been looking for, especially local clients. So I think it's a great, that we're connected and have similar interests in that healthy functional approach, that holistic approach, but also bringing in conventional medicine as needed. So I think a lot of clients would benefit from that. If there's anything else you want to add, I have a bonus question for you. If anything, you just add other thoughts, but what is your top suggestion you can share, like off the top of your head, to help women if they're feeling burnt out? One game changer thing that might help. I know it's holistic, so there's many contributing factors, but what is one thing that you think is pretty important when it comes to burnout?
Yeah, when it comes to burnout, that's something that, so many people struggle with. And it can easily happen when, we're just going through our life, and then it just can kind of hit you, and, to kind of give one thing is setting boundaries, if I can give three things, to be honest, setting boundaries and saying no, and just giving yourself that respect to do those things. Most people, if you are firm in your boundaries and you say, no, I can't do this, they'll respect that, and when you give yourself respect, like I said, most, people will show you that respect back. And just really making sure that you're first taking care of yourself. And that's, easier said than done. I still work on that, it's a daily thing that, we have to work on, but just, taking care of yourself and setting those boundaries and saying no when you need to say no.
That's good advice. Like putting ourselves as a priority, because sometimes we take a back seat, we say yes to stuff we don't want to do, commitments, and we're overloaded and our calendar's overloaded. And it's like, why did I say yes to all these things I don't agree with?
Exactly.
I heard a good quote the other day was, people with boundaries respect people with boundaries. People who have boundaries respect people with boundaries, because they get it. They also have boundaries.
Totally.
I thought that was what resonated.
That is, that's a good, and that's the thing is you might actually inspire that person to make boundaries for the next time. You're like, oh, wow, that was, she said no to that. Wow, maybe I should say no to this other thing that I didn't want to do or can't do, so it can kind of have a ripple effect too.
Sure. Yeah, for sure. That's good advice. I think people will benefit from that. Those are the questions I have. So it's really nice to learn more about you, like why you got into this field or both fields, how they jive together, how you work with people, how you go about that, what your process is. So I found that really helpful. Do you have anything else to add? Any last thoughts?
No, I don't think so. Thank you so much for your time. And I love, what you're doing with your clients. I think it's such a needed service to offer to people. So thank you for what you're doing.
Oh, thanks. Yeah, no, I'm looking forward to working together more and going for walks too when I'm
Yeah,
in town.
I love
That's
that.
how we got hooked up in the first place. We went for some walks.
That's right,
Um,
exactly.
yeah, thanks for joining me on this. I will stop the recording now, and thanks everyone for watching today's video.
Awesome. Thanks, guys.